That'll be good right there. Hello. When someone hears the word psychedelic drugs, they think of the 1960s and the hippie revolt. But psychedelic drugs are getting a second look by the mental health professions. An organization, MAPS, which stands for the Multidisciplinary Association for Psychedelic Studies, oversees all the studies that pertain to psychedelic drugs. Everything is overseen by Rick Doblin, PhD, and founder and director of MAPS. Today I would like to discuss the research of psychoactive drugs and their use in the mental health profession, specifically drugs such as MDMA, also known as ecstasy, ibogaine, and psilocybin, also known as magic mushrooms. MDMA, also known as ecstasy, is a synthetic compound used for the treatment of PTSD, post-traumatic stress disorder. Most patients only need a few sessions, and MDMA helps decrease fear and the defensive response while increasing trust and empathy. This allows the psychologist to get into the head of the patient and get out the things that's bothering them and causing their post-traumatic stress. Less than 1% of the patients had any side effects. Most only needed a few sessions to resolve any problems that they had. Next, I'd like to talk about ibogaine. Ibogaine is a naturally occurring psychoactive drug derived from a West African shrub called iboga. In the past, it was used to assist heroin and opiate-dependent patients to recover from addictive habits. It has little or no use for potential abuse as a street drug, but there is a risk for mortality, a 1 in 300 risk. But usually this is associated with concurrent drug use and the patient's not coming forth with any drug use or any health problems prior to taking the ibogaine. Most patients fully recover from addiction after just one session. Next, I'd like to talk about psilocybin, which is also known as magic mushrooms. Psilocybin is a naturally occurring psychoactive drug that's in magic mushrooms. Studies right now at Johns Hopkins Hospital with patients that have cancer and depression are undergoing studies with psilocybin. A single high-dose session had drastic positive effects with these patients. The most reported side effect was initial anxiety, which was controlled with medication. Most patients felt positive effects from the sessions for up to 6 months. Ongoing research with the FDA will determine the future use of these drugs. And with the help of people like Rick Doblin, the director of MAPS, and MAPS, hopefully these drugs will be brought to the forefront and used in clinical settings. As you can see, psychedelic drugs such as MDMA, ibogaine, and psilocybin have profound effects and uses in mental health. Hopefully, with current research, we can get FDA to revisit the scheduling of these drugs that in the past were classified as dangerous out of the fear of the unknown, and hopefully bring more help to people that current drugs are not working on. Thank you.